Hello, this is Dr. Linda Bluestein, and today I would like to talk about, is an EDS or HSD diagnosis necessary? And most of you may already know, but just in case you don't, EDS stands for Ehlers-Danlos syndromes and HSD stands for hypermobility spectrum disorders. So what are some of the reasons that we are often given for why these conditions are often misdiagnosed and missed? So one of the most common ones is that there's no cure. The second one that we hear very commonly is just there's a lack of awareness or knowledge. And the third point is that oftentimes the provider doesn't have the time or interest in listening to the patient. The next reason is the lack of expertise on the part of the clinician. The 2017 criteria that was laid out by the International Consortium on EDS and Related Disorders is very detailed and is a lot to comprehend for physicians that do not routinely care for this population. And a lot of clinicians may really not want to go there and get into those details and really learn about these conditions. And the last reason that I would give for why this is a common problem, why we are often not getting these conditions diagnosed properly, is that in medicine right now, we are often dealing with the tip of the iceberg. So rather than dealing with the root cause of a problem, we're kind of putting a patch, we're kind of putting a Band-Aid on most problems and conditions. And the reasons for that are that that's quicker, it's a lot quicker to give a pill or, do just kind of deal with the bare minimum that we have to than to deal with the root cause. So those are some of the reasons why conditions like EDS, Ehlers-Danlos syndromes, and HSD, hypermobility spectrum disorders, are so often missed and misdiagnosed. So again, just to recap that part, one is because people will often say, well, why bother making the diagnosis because there's no cure? Number two, there are clinicians that do not have enough knowledge or awareness of these disorders. Number three, they don't have the time or interest in listening to the patient. Number four, they lack the expertise necessary to make the diagnosis of these conditions. And number five, because medicine currently very much is involved with treating the tip of the iceberg and not the root cause of our problems. So now I'd like to talk about why we must diagnose these conditions appropriately. And the goal is to diagnose people accurately, not just sometimes I hear people say, well, we need to diagnose more people. And we always need to remember that hypermobility can be associated with literally hundreds of different conditions. So just because a person is hypermobile and has symptoms does not mean that they have one of the types of Ehlers-Danlos syndrome. It does not mean that they have hypermobility spectrum disorders. It means that they have symptomatic hypermobility and they need to have that worked up and addressed and really have a really good history and physical. That's where the doctor asks lots of questions and gets a lot of information about what you've been dealing with in the way of symptoms, and then does a physical exam in order to establish the proper diagnosis. Okay, so why must we diagnose these conditions appropriately? Number one, it's validating. It's validating for the patient, it's validating for their family, and it's also validating for the providers. Number two, it broadens the patient's access to care. So once the diagnosis is made, oftentimes a person is able to get referrals to specialists. They are able to get access to other therapies like acupuncture or dietitians, things like aquatic physical therapy, or their insurance carrier, maybe they normally do allow the person to have physical therapy, but once they have a diagnosis of Ehlers-Danlos syndromes, they have access to more sessions, which they often need. It's very common for people that have conditions like Ehlers-Danlos syndromes to be in and out of physical therapy for a really extended period of time. That's really common. Okay, so next, we need to have these diagnoses for research purposes. So if we don't evaluate people and assess whether or not they might have conditions like hypermobile Ehlers-Danlos syndrome or one of the other subtypes, or hypermobility spectrum disorder, and people are not appropriately diagnosed, we don't have the data that we need in order to do the research that we need in order to help people, which we desperately need to do because these conditions affect a lot of people. and they're affecting them at young ages. And so we really need to do a much, much better job with this. And finally, I would like to just repeat a quote from a patient who said, "Simply getting my diagnosis helped my pain a lot. As a young dancer, I started getting pain around age 12, which increased with puberty, and suddenly I started getting injured a lot. Subsequently, I developed a sleeping disorder, fatigue, and weight gain. And after going into a lot more detail, of course, and obtaining a lot of information with this person, I heard from them 2 weeks after our first appointment together. And they told me, I'm doing so much better after just 2 weeks. Now, that's not a typical situation. That's not a typical scenario. Oftentimes it takes much, much longer. And of course, there are people that I have not been able to help, but most people do report that they feel better. So the last thing I wanted to mention is that one of the reasons why people say it's not worth having the diagnosis, in part with the no cure, excuse, is that, there's nothing that we can do for people. Well, it is true that there are no FDA approved drugs for Ehlers-Danlos syndromes and hypermobility spectrum disorders. However, we do have ways that we can manage symptoms. My colleagues and I, who take care of people with conditions like EDS and related disorders, we know that there are effective strategies to help improve symptoms. It takes time, patience, and effort on the part of the physician and the patient, but it can be done. People can feel better. So I want this to be a message of hope. And I know that people have difficulty getting providers that are able to help them with these conditions. I hope that you will check out the EDS Society website. They do on their website have a list of providers all around the world who can see people for these disorders. And I can't see people in every state in the United States for actual treatment and diagnosis, but I can see people from a number of states. And there are, of course, a lot of other people besides myself caring for people with EDS and HSD. So I hope this was helpful. And if you'd like more information, so check out the Bendy Bodies podcast that I co-host with Jennifer Milner. And you can find that on pretty much all of your favorite podcast streaming platforms. So please check that out. We also have a YouTube channel as well. And you can find us on, it's at Bendy_bodies on Instagram. And we are at Bendy Bodies Podcast on Facebook. So have a great day. I hope this was helpful. Bye.